Is sponsored by CommonSpirit Health. Many people out there, including myself, suffer from pain every single day. Dr. Jeff Pence is here to share how CommonSpirit Health is working to relieve pain for patients. Welcome to the show, Doctor. It's great to have you. This is a topic that I'm near and dear to.
Yeah, thanks for having me. I'm super excited to be here and chat some more about it.
Thank you very much. Well, you're dressed the part, and you've seen this a lot. So what does the typical patient look like that you take care of? What does that look like?
Yeah, so the most common thing we're seeing in the clinic is back pain. Right?
Yeah.
So typically low back pain, and it can be acute, like it's been going on for a few days or weeks, right? And that's usually due to like an injury, motor vehicle accident. I will also see patients that have been dealing with pain for 30 plus years, right?
Really?
They've had surgeries, they've had other treatments, and they're still dealing with it. But really, if you have pain anywhere, headaches, abdominal pain, you can be seen in the clinic.
I gotcha. Why did you personally choose to practice pain management?
What I love about pain, well, actually the way our medical training works is during medical school we get to rotate through the different specialties, so we can kind of get exposed to everything. And I loved pain management because I'd see patients that come in and pain was like greatly affecting their quality of life, right? Someone just wants to stand in their kitchen and be able to cook Sunday dinner. Someone wants to just play a round of golf without being bedridden for 2 days after. Yeah. Who can just help these patients like get back to doing what they love and give them their life back.
It does change your life, doesn't it? It affects everybody as well. Those that are out there suffering from pain, what would you like them to know?
To not settle, right? There's so many treatment options. I think a lot of times people are unaware of how many treatment options are out there. It makes me super sad when I see someone in clinic that's been dealing with pain for several years and they've just been told like, it is what it is, like this is your life. And a lot of times that's not true. There's a lot of things we can do and there's a lot of tools we have to manage pain. And so I would just tell people don't settle for pain that's affecting your quality of life.
You mentioned those tools. I'm curious, what's the best way to prevent chronic pain?
So I love that question, and people don't love my answer because it's typically just the cliche things, right? Like exercising regularly, stretching.
It's the ABCs.
Yeah, eating healthy, managing your stress, getting adequate sleep, just the things we all know we should do. Those are the best things we can do to prevent chronic pain.
I got you. And there's things that you utilize to help treat people. Did they have to take opioids, injections to see the pain management specialist, the physician?
Yeah, so I think that's kind of like a generalization or a stereotype I hear a lot as a pain doc is I don't want to go see a pain doc, he's just going to make me do shots or injections, or I don't want to see the pain doc, he's just going to put me on opioids and I'm going to get addicted, and that's not true. Like for example, let's say you came and saw me and you had low back pain. I'm going to give you several options of things we could try. Okay. And together we're going to decide what's best for you, and we're going to try different things. And I'm never going to force you to take opioids or get an injection, but there's just so many options available to patients.
The key is to be with someone that has the experience, the specialized, so you can have that conversation and manage it together, correct?
Correct.
Awesome.
Yeah. Super important as well to like make sure you establish the correct diagnosis, right? And that's key first visits. We want to figure out exactly what's causing your pain so we can appropriately treat it.
The root problem for sure. Where can we go for more information?
So you can call the clinic. There's a phone number I think that's listed, and also our website. It's a great place to start.
Awesome. I think that information is right on this screen. Thank you for your time, Dr. Pence. We appreciate it. Keep up the good work.
Okay, thanks for having me. Appreciate it.